Hello everyone, my name is Alissa and I chose to do the topic regarding lung cancer. Just a little bit about lung cancer. It is the leading cause of cancer-related death in the United States. There is an equal distribution rate between both females and males regarding lung cancer, although African American males do have the highest incidence rate. Developing countries have higher incidence rates as well, as opposed to countries like us, the United States, typically because they are exposed to more chemicals and toxins in the air. Although rates of lung cancer have been decreasing over time, the last 10 years they have significantly have dropped. And I think this is due to education. People are now aware of smoking and what it can do to you, including lung cancer. So that's great that these rates have been continuing to drop and people are quitting smoking knowing that they could potentially develop lung cancer. Typically, the average year diagnosis is 70 years old, although people can get it in their 50s, 80s, but the average age is 70. There are two types of lung cancer, or two categories. There's small cell lung cancer and non-small cell lung cancer. Small cell lung cancer typically occurs more in heavier smokers and is more difficult to treat, whereas non-small cell lung cancer is slower growing and is the most common type of cancer in non-smokers. The cause of lung cancer is mainly linked to smoking. Obviously, genetics and occupational environmental risk can play a role as well, but mainly smoking. Basically, with lung cancer, damaging cells that line the lungs over time keep getting damaged by smoking, etc. The cells act abnormal, causing the cancer. As far as risk factors of lung cancer, like I said before, 85 to 90% of lung cancers is related to tobacco smoke. Another huge chunk of lung cancer patients were exposed to secondhand smoke as well. They're living with the smoker or exposed in the workplace. Radon exposure and any occupational environmental exposure, any exposure of chemicals, nickel, arsenic, etc. That's not good for your lungs. Obviously, family history of lung cancer, you have a chance of getting that as well. And then any history of lung disease, infections, COPD, that can contribute to lung cancer as well. Symptoms of lung cancer include coughing, difficulty breathing, chest pain, hoarseness, recurrent bronchitis, fluid in the lungs, any blood that you may cough up, bone pain, arm pain, weight loss, fatigue, nausea. Once you realize some of these symptoms aren't so normal, you will go to your physician. They'll do a physical exam. They'll take a biopsy, a scope in your bronchioles, blood work, CBC, pulmonary function test, and then depending on the stage of lung cancer, they will do other tests to see if it has spread, as far as brain and spine MRI, bone scan, PET scan, lymph node sampling. As far as treatment goes, surgery to cut out cancer tissue, chemotherapy killing all the cells, including cancer cells. Radiation therapy is an option to maximize tumor control. And then targeted therapy is also an option. They're drugs to block and stop the spread of cancer. The goal of this is to target specific components of cancer cells without harming the normal cells. And then as far as follow-up care and education, once the cancer is clear, repeated imaging every 6 to 12 months is suggested annually. Obviously, if you were a smoker, quitting smoker and changing your lifestyle habits, making sure you're getting a well-balanced diet, physical activity, and then cardiac and routine medical care and cancer screening as well.